Good afternoon. My name is Nate. This is UMFS Live. I want to thank everyone for tuning in to join us for episode 4 of season 4. Today, we're going to be joined by Rachel, who is the nurse at Charterhouse School in Edinburg. I'm excited to have and dial her into the room right now. Should just take a moment. And there she is. Rachel, good
Hi.
afternoon. Hey, Rachel, thank you so much for joining
Oh,
me
yeah, definitely.
episode of UMFS Live. It's such a thrill to be able to talk to different staff and team members over at Charterhouse School in Edinburg, and we've also had an opportunity to talk to some of the in Richmond as well. So thanks again for being here, and I'll jump right into the first question.
Okay, sounds good.
Tell us, how long have you been at Charterhouse School, and what brought you?
So I actually was looking today. Today I've been here for 4 months exactly. So yeah, 4 months as a school nurse. Before this, I worked as a bedside nurse in the hospital. And the last 2 years have been a hard 2 years for everyone, but nurses and especially. So I was ready for a change. I have 2 little boys at home. Wanted to be home more with them. And so I saw the position online. I had a couple different nurses encourage me to apply, and here I am.
Well, we're so grateful that you chose to join UMFS and Charterhouse School, and we certainly appreciate the work that you do as a nurse, and knowing that direct care staff and school staff had just such a challenge with COVID. But we're starting to feel pretty good. Things are looking good moving forward, and we're just so happy that you're part of the Charterhouse School family. So thanks. Let's see. Tell us then, what inspired you to become a nurse? You said that you had done bedside nurse. This has been your career for a little while. Can you tell us what inspired you to do this important work?
Well, it's kind of a roundabout way. I kind of have always been in a serving type position. My background started in education, actually, before nursing. I was a behavioral health aide in schools, and then I became a special ed TA. And I don't remember, even way back in elementary school, I remember thinking I wanted to be a nurse. And so after I got married, decided to go to nursing school. And yeah, it's been a wild journey. So yeah, my background was with kids, and started working with adults, and here I am back with working with kids again. So
What do you enjoy most about service to others, this important work that you do?
I love working with kids because I can see them growing and changing every day. Even in the 4 short months I've been here, I've been able to build relationships with the kids. We work with a group of kids that have had a hard life. A lot of them have come from traumatic backgrounds, and being able to like break through those barriers and get to know them, to see them challenge themselves to grow, and break through these molds or stereotypes that we so often put them in, been really rewarding.
Well, I'm so glad you said that, because as someone in my position who gets to about different programs at UMFS and the different work that we do at Charterhouse School, both in Edinburg and Richmond, I can always see the impact that your staff have on these young people, these students, and it's so tremendous. But with that, for as much as you're able to impact them and what you learn from young people, is there something from the children that you've learned specifically, or maybe even other patients throughout your career? What have you learned?
Well, I'm always learning new things about all sorts of video games from the kids. But no, in all seriousness, when I think about it, I guess I go back to working in the hospital, since I've only been a school nurse for a short period of time. There has been a lot of illness and death in the last 2 years. That has obviously impacted my life. And one thing I took away from it is you have to live for today. You have to do what you want, and tomorrow's not guaranteed. So today is what we have. So whether that's hanging out with kids and building relationships with them, or on the weekends, spending time with my boys and my husband, this is what we got. So tomorrow's not promised.
That's beautifully stated and takes me right into the next question. You mentioned a little bit about, spending time with your husband and your children, and we got to see the photo of your children that you
Yeah,
shared with
my two boys.
social media. So what do you all do? What do you like to do when you're not working? Reset, recharge. What do you guys get into?
Well, thankfully we live in an area of Virginia that is very. Did I? Sorry, my phone is low battery. We live in a very outdoorsy area of Virginia. We do a lot of hiking. We take our boys camping. My husband and I are both very outdoorsy, so we have tried to instill that into our two children. We've started our garden this year, and I'm training for my first half marathon, which is at the end of this month.
Oh,
So
congratulations. So you're staying quite busy. You have lots of
we
different.
do. Two boys keep you busy in general. So yep.
Well, I'm jealous that you're planting a garden. It's always been a goal of mine, and I always usually make it just the first few weeks, and then things start, and I just move on to the grocery store from there. So I hope it all works out well for you all. This has been
Thanks.
great. Rachel. It's so good of you to join us on UMFS Live. I want to move us to our last question and be mindful of your time. Just wondering, can you talk about what keeps you coming back? Certainly at Charterhouse School, but in this profession of nursing in general, what keeps you coming back to serve others?
Um, well, let's see. In general, I don't know. For school nursing the kids, building relationships. That's something I didn't get as much with bedside nursing. I got to take care of very sick people. Most of the time, got to send them home with their families. Here at the school, I get to see my students every day, and I get to build into them every day. And that relationship part is what was missing for me in
Yeah.
bedside. So I mean, we have students here for several years at a time, sometimes just a few months. But if I can be one of the people to build into them, to be a safe person, be a safe spot, that's what brings me back.
That is an absolutely perfect statement. One of our values at UMFS is relationships are our building blocks. So I think that you've just encapsulated that so well. Rachel, I want to thank you for your time today, for joining us on UMFS Live. For everyone who tuned in, thank you for watching. You can also go back to our main Instagram page and watch archived episodes. Follow us on Facebook. Visit umfs.org or charterhouseschool.org to learn more about the great work that Rachel and her team are doing. I appreciate it, Rachel. Have a great rest of the day.
Yeah, you too. Talk to
All
you
right.
later.
Bye.
Bye.